I want to address tattoos. I can't tell you, and I'm sure you know from your own practice, how many people these days have tattoos. But what they don't realize is these tattoos can have a matrix of adhesions underneath. Sometimes tattoos cause a restriction in range of motion. Sometimes they can cause pain in certain areas of the body. And I'd like to share with you a very quick story. Was one of my classes that I was teaching. This student came in and she had a large mandala on her shoulder. And she was actually a practitioner of yoga. And after she had her tattoo, about 6 months later, before she had her tattoo, she was able to raise her hands up perfectly normal, both even. After her tattoo in 6 months, this is what she saw. She couldn't understand why her one arm was not as flexible and did not have the range of motion. And I said to her, I said, can I come in and look at your tattoo? And I close my eyes. So what happens is I kind of close my eyes and you start very lightly feeling that tattoo and you can feel that matrix of adhesions that were lying underneath. I said, can I use you for a model for our class? So she said, fine. She came in, we did the tattoo technique on her, and because it was on her shoulder and she was having that range of motion issue, I put a very large, extra large silicone cup on that tattoo, and we were taking her in range of motion. She got up off the table, and lo and behold, her arms were completely level. And because we have cell memory, this needs to be repeated. Yes, we were able to affect a change after the first treatment, but cell memory will take it back to where it was. So she would have this every week for the next 2 months, or maybe months, depending how she was progressing, and it eventually resolved itself. So I want to share with you how we're going to work a tattoo. It's very easy. And one thing about tattoos, the older the tattoo is, the heavier handed your tattoo artist was. And they tend to be a little bit more problematic than recent tattoos. How long have you had this tattoo?
3 years.
3 years? Okay. Yeah, I found the ones that are 7 to 10 or more years older. The artists were really, really heavy. The needles were going in extra deep, and the ink was a little bit deeper. And anything that was really blackened really was problematic for those people. So we've got them all lubricated. So what we want to do is we want to come in and we want to find the right cupping tool to use. And I looked at several, and you need to pick a tool that is wider than the area that you're going to work on. So you want to start off by just going around the perimeter of this tattoo, and just with some suction and release, kind of moving that fascia, loosening it up. Depending on what you feel, how much scarring you can feel, or adhesions, underneath the surface, that will depend on how much of the suction release technique you're going to use. Sometimes when we start releasing these tattoos, I've actually released a few, and they were portraits of family members that have passed away, and there was a lot of emotion in that tattoo. So it's not unusual when you release the adhesions that are built up in that tattoo, if your clients can become very emotional. And I've had them where they actually broke down and were crying, and you just give them the space that they need, and then you can continue. So once you've done the suction and release around the perimeter of the tattoo, we're going to start using a technique. It's called rolling rotation, and we're going to pick a cup that is slightly larger than that area, and we're going to come in, and as strong as we can get this cup, we're going to do some rolling rotation on this. And I'm not happy with this cup, so I am actually going to change to a different cup because it's not giving me the suction that I need. So remember, you're still lifting. So we're going to change it up because this is a little bit uneven and I'm not happy with. I need to get a suction that is extremely tight for this client, and I'm going to change over and we're going to take this cup because it's the area that I, there we go. Can you feel the difference? Okay. Is this too much for you?
That was good.
Okay. You can see the pinkening, and that's what I wanted. So sometimes when you have to get a little bit more aggressive with tattoos to really affect that change, and it all depends where they're at. Now it looks like you've got a red sun around your tattoo, which is awesome because that is fresh blood being brought into the area. It is taking away any of the stagnation that's built up inside of those adhesions. So this is awesome. This is exactly what we want to see. Anytime you're working on that uneven surface, this is what happens. It comes off, you just reattach, and you go back. Do a little twisting. So the last thing we're going to do is drag it over, drag it over, drag it over, and I'm going to use my hand because that's way too strong. Drag it over to the axillary area, and drain. Okay, thank you.